morning and good afternoon. I'm Melissa Faulkner, the Executive Marketing Director of UCSF Health Hub. Thank you so much for joining us for UCSF Health Hub Winner Circle webinar with Accolade Health. Our topic today is why advocacy, why now? I would now like to introduce our host, Mark Goldstein, Chairman of UCSF Health Hub and partner at Builders VC.
Thanks, Melissa, and good afternoon to everyone, mostly of your afternoons. Really excited about today. First of all, it's really no secret that healthcare is so complex. The high cost of getting employees to the right care, it's unpredictable. We all know it's unsustainable. We can't keep spending this type of money on healthcare as a country. And this is in great part in why advocacy is so essential, to ensure people get the healthcare they need when they need it. So today, what we're going to hear about is really why advocacy, why it matters, and really importantly, why it works. And before that, I'm going to talk a bit about me and about Health Hub. My day job is a venture capitalist, but by night, I'm chairman of UCSF Health Hub, and we are a nonprofit affiliated with the University of California, and we help companies, great healthcare companies, scale and grow. And at UCSF Health Hub, we have thousands of members and companies and advisors and investors. And Accolade was one of our big winners from our award show last year, which we'll talk about. We're based in San Francisco and in the middle of Silicon Valley, and we see ourselves being really at the center of healthcare innovation out here. UCSF is the recipient of more NIH grants. So what comes out of UCSF is pretty incredible, but as if not more incredible is the ecosystem around Silicon Valley. But increasingly, what is Silicon Valley? And with COVID, location matters less and less. What's going on in Philadelphia is equally incredible, and Accolade is an example of that. Health Hub Connect, we do a few things at Health Hub. Help early stage companies get connected to advisors and investors and people they need to basically grow their company. And then we help later stage companies with our award show. Our digital health show, which we had last year, Accolade was one of our winners. And Rajiv Singh was elected to our UCSF Digital Hall of Fame. And there only are 5 or 6 people in this Hall of Fame. So it was an incredible honor, and an honor too that really goes to Accolade and what Accolade has done, and why Accolade to us is an example of what digital health is becoming, why digital health is important, and a great company. This was an award they won, and he's our member of our Hall of Fame here in Mission Bay. We have coming up on October 7th, we have next year's show. It's now called the UCSF Health Award Show. It is going to be back in person. We will, of course, see what that means as Delta unfolds in front of us. But we have this year over 1,000 companies have applied and submitted for awards. So winning an award is a really big deal. So I'm going to get into today's event. And really, we talked about like healthcare being the top reason, increasingly the top reason why employees are even choosing companies. The old model of walking down to HR doesn't really fly anymore. And it's the same thing that's happened in retail. It's happened do you call a stockbroker anymore? Do you go down to your town hall and basically fill out forms? No, it's all about automation and smart automation. And that's really a lot of what advocacy is about. Accolade has built its healthcare solutions on this foundation based on advocacy. And its solutions can be tailored to really any business, large or small, to best meet the budget and needs of whatever the employee count are. They use great technology and data and basically help their members or employees make the right decisions. Then their patient-centered care model guides people to in the right direction, gets them to the right care at the right time, and it's really dependent upon where they are in their healthcare journey. Fundamentally, this is huge cost reduction, but also great for employee retention. And Accolade's advocacy program works with employees and their families because it guides them to the right preventative and mental health care solutions that can prevent those crises and those future events that really blow everything up, and those chronic conditions that we don't like. Sure, some chronic conditions are going to occur, but the best thing we're all trying to do in digital health is, can we defer them? Can we mitigate them? Accolade's expansive suite of solutions really gives employees the options of meeting with specialists in person or basically doing it online. Today, we're going to basically find out more about this from some of the leaders from Accolade. Our speakers include Rob McElivray, who's the Vice President of Employer Sales, Lenara Shrugs, who's a Senior Solutions Specialist, and more. As I get into the intro, I think what you need to know here is Accolade really wants to reinvent healthcare. They're on their way. They are one of the most important companies in digital health today. Their solution and what it is they do and how they basically can take employees down the right path is making a difference in thousands of organizations, both mid-size and enterprise size around the country and increasingly around all of North America. So really with that, I'm going to basically go into why advocacy is the foundation, providing the best care to employees and the savings on costs. I'm about to hand it off. We've got a great group here. Rob is the Vice President of Sales for Strategic and Enterprise Business at all of Accolade, and he leads the national team that focuses on employees improving their health outcomes and helping employers lower their healthcare costs. Before Accolade, Rob's been around the block. He's worked with tons of other technology and healthcare organizations. Lenara is a Senior Solutions Specialist, and she really helps companies be successful with Accolade. She basically supports sales, marketing, customer. I'm going to turn it over to Rob. Rob, all you.
Mark, thank you so much, and good afternoon, everybody. Mark, thank you for the warm welcome and for sponsoring today's event. We're thrilled to be here. Lenara and I are excited to share our insights today. And guys, today we're going to spend time, as Mark said, walking through and talking about healthcare advocacy and really how it can address the problems that we're facing in healthcare today. We're going to talk about what advocacy is, how it helps both the employer and their employees, and what it means overall for a business. So no matter, as Mark said, no matter what size company you all are or what business you're in, healthcare advocacy can improve healthcare outcomes and lower costs. And we're excited to talk more about that today. So let's jump in and let's begin with the conversation really with what we all know today, and that is that the current state of healthcare is really unsustainable. It's unsustainable because healthcare is complex, it's broken, and it's not getting any easier for us to navigate. In fact, we know about the costs. We hear it every year that healthcare costs continue to rise as much as 6% on an annual trend. But now healthcare has come vastly unpredictable, and the pandemic has taught us that. And as a result, there's a bunch of pent-up demand on a few different fronts. First, let's talk about preventative care. You know, last year we saw massive decreases in preventative care, things like cancer screenings, preventative visits, as well as vaccinations, childhood vaccinations. And as a result, people didn't get care. They didn't want to be exposed to COVID. So now providers are in this unfortunate spot of being overwhelmed with makeup appointments, and it's getting harder and harder to see your doctor in a timely fashion. But the pandemic also brought forth that need to deal with mental health. And we saw this dramatic shift towards mental health services because anxiety and depression, that all rose last year, over 200%. This is a key component, folks, why healthcare advocacy can be so important right now. The mental health crisis that we face in our country was already addressed by the population, but now we need to go tackle this thing head on. So even though care was being delayed during the pandemic, it was also continuing to evolve. And Mark talked a little bit about this in his introduction, right? Accessing care became difficult as clinics around the country were stressed or even closed. Getting an in-person appointment was challenging for many Americans. And I bet you can guess the end result. Yes, telemedicine utilization went up. The push for virtual care went up. And we're going to talk today a little bit about how we see virtual care and advocacy working together in tandem, because we believe it should do that. So let's talk a little bit now about how HR teams have tried to address these various challenges. So we know that HR teams are really overburdened right now. And the fact is that managing a benefits program like you do today through unprecedented healthcare disruption has an additional layer of complexity in your day-to-day. Because of that pandemic, many employers turned to various point solutions and various programs with the idea that if you could tackle just a little bit of that issue head on, you're going to start to make an impact. But in reality, relying just on those siloed solutions isn't a comprehensive approach. In fact, we believe there's a different way to look at this problem. And in fact, we think a comprehensive solution is the right approach. And what do I mean by comprehensive solution? Well, first and foremost, a comprehensive solution has to reach everybody. Engage as many members as possible across the organization. Most members, as we know, don't understand their benefits, and they need guidance and reassurance about their healthcare decisions. Secondly, a comprehensive solution needs to really identify those personalized needs. Healthcare is deeply personal. It's really, really important that we understand the context of what a member is going through before we can even begin to think about a solution and or aligning them with the right types of care or providers that they need for their situation. And you can see from this stat here that 40% of people are not seeing the right provider for their needs, and most don't even have the tools to be able to effectively search for those right providers. And finally, a comprehensive solution in our mind is going to guide clinical decisions. Let's take all the information that's available to us through the health plans, through the point solutions, through conversations, and really understand the context and be able to get that person on the right path. We're all going to use healthcare, and we need to be supported in that journey that we go on. The data tells us that unnecessary care and uninformed spend or uninformed care decision, I should say, are key contributors to the waste that we see in the system today. And over 30% of healthcare spend today is wasted in the United States. So now let's dig a little bit deeper into what advocacy is and how it can help address these challenges in a comprehensive way. I'm going to turn it over and introduce Lanera Scruggs to take us through a few thoughts there. Lanera?
Now I get to introduce you to advocacy and how it can help solve those problems. To start off, let's level set on what we mean when we talk about advocacy. Advocacy is direct healthcare support for individuals and their families. Healthcare advocacy helps people get to the right care. It supports individual members. It enables a focus on patient-centered care. It empowers people to make their own healthcare decisions, and it helps to save on healthcare costs. To be successful, an advocacy solution has to be people-centric. It has to treat your employees like what they are. They are people with families and lives and concerns about healthcare that cannot be addressed with just data. And so this model, the healthcare advocacy model, when it's done right, it supports your employees when they need it most, and it helps to lower healthcare spend without losing focus on the individual. So let's talk about how advocacy should work. Advocacy solutions should engage the entire population, just like Rob said, not just the unhealthiest individuals. Our goal at Accolade is to help people live their healthiest lives. It's important that your advocacy solution work in tandem with plans, with providers, to help fill critical gaps that occur in the healthcare journey. We can do this because we have a thoughtful and complete view of the individual. We understand the whole person and the context of their lives in order to provide the right care for them. We use technology and artificial intelligence to help us understand every individual's healthcare journey. But most importantly, and I can say this as a former health assistant, we have a frontline care team who gets to know the member and their family. It's a team that's empathetic, they're proactive, and they take the time to build trust with the members we're supporting. So it's this combination of smart technology and empathetic humans that allows us to offer guidance for preventive care. It allows us to increase member engagement, to help employees navigate their benefits, and to deliver better clinical outcomes. On the last slide, I mentioned the importance of understanding the individual. One size fits all does not work for advocacy. In order to be successful, interactions need to be personalized. That's why it's important to be data-driven. For example, at Accolade, we use claims data, member insights from our care teams, ecosystem data from our integrated point solutions, and machine learning to help get every member the right care for their needs. We use these insights to personalize the care for each member and their families. So for instance, certain triggers may alert our clinical teams that Joe Smith hasn't seen a primary care physician in over 12 months. We might have a nurse reach out to ask if Joe has scheduled his annual care appointment yet, or he might receive an email about preventive care along with a reminder about the benefits the company offers. So when Joe, our member here, takes an action by responding to the outreach, this feeds back into our system, and we keep learning and optimizing for that member. The cycle continues, and every engagement we have with a member makes the next one more effective. This is how we are able to improve health outcomes and lower healthcare costs. Another major component of successful personalized advocacy solution is being a single point of entry. This is what we do at Accolade. As you can see on the left-hand side of the slide, everything comes through us, whether it's records from the provider, claims data, a member phone call, or a message. Our health assistants and our nurses are approaching every situation using a proprietary influence model and empathy that's backed by data-driven insights. And it's that combination that means that every member will have a personalized clinical guidance. So that's all in theory, but let's take a look at how the specific impact that advocacy has for your employees, what that really looks like. Every day, Accolade focuses on member experience, and there's no better way to translate who we are than to share how we interact with those members. So we're going to take Timothy for an example. I won't read this entire quote to you guys, but you can see that he starts by saying, "My nurse Joanne was a huge help to me." He continues and mentions that the doctor he's now seeing is currently screening him for tumors. And he ends the quote by saying, "But if it weren't for Joanne, I wouldn't have known where to start. She very well may be a lifesaver." Timothy is just one of our members who shared his story with us and how healthcare advocacy helped him. We have hundreds of member quotes just like his, because it's a testament to our people and our focus on your employees and their family members. We can talk about advocacy and how it's helped another member through their healthcare journey. So what you can see on your screen right now, this is a true story about a member with a diagnosis of dry macular degeneration caused by medication. Her condition had gotten worse and she was fearful of losing full vision. So as expected in a situation like this, her physical condition was also having an emotional impact on her life. An Accolade nurse helped her to get a second opinion and connected her with a behavioral health clinician on our mental health integrated care team. That mental health integrated care clinician not only validated the member's concerns, ensuring that her physical and her mental care were integrated, but also connected her with Ginger, which is our on-demand virtual mental health partner. The member has since received care for her macular degeneration. She's gotten an anxiety medication, and she has reported emotional improvement as she continues to attend her mental health appointments. This impact, this level of care, it's made possible by our holistic approach. Our medical nurse and our mental health clinician work hand in hand, consulting and coordinating care to make sure that they're supporting every need without it feeling overwhelming to the member. And it doesn't stop there, of course. As this member continues in the program, the mental health clinician will continue to check in to assess that member's levels of depression and anxiety, her quality of life, and making sure that we're providing further guidance and support as needed.
Lynera, those were great examples. I think she did a great job of really explaining some of the key components of advocacy and why it's designed the way it is and what it should do for individuals along the way. But let's talk a little bit about all of this and how it translates into some of the healthcare costs and look at some of the numbers to further illustrate some of the savings opportunities, as well as some of the challenges that I outlined earlier. We conducted a survey and a study in 2018. And in that study, we uncovered some really plaguing issues in the current healthcare system. One look at these numbers, and it's really not that hard to understand why healthcare costs continue to rise. For starters, employees aren't getting the care they need, even when employers do their best to try to provide the necessary programs. In fact, 43% of the employers we spoke to said their healthcare services and programs aren't being utilized. Many employees don't really understand where to turn or where or how to use the service. So it's not surprising that when they make uninformed decisions, it results in time away from work. In this case, it helps employers understand that over $1,600 per employee are spent due to or attributed to absenteeism, from injury or illness costs. So, when we think about that, right, go back to the problem we were talking about earlier on. At the top of all of this, only 24% of employees actually understand their healthcare benefits. And if employees don't understand their benefits, we can't expect them to make the right care decisions. So all of this adds up to that big staggering fact, right? There's $3 trillion of spend on healthcare in this country, and about 1.2 of that is wasted spend. And that's where an advocacy model can really make a huge impact at any company, at any organization. So here's the good news, folks. No matter the size of the organization or the industry, advocacy will make that impact. So whether your employees are trying to understand their benefits, and it could even be yourself, or as an employer, really trying to manage healthcare costs, you have an opportunity to take advantage of a solution. Let's take a quick look at what we found through an independent study that was conducted by Accolade by Aon, that shows the savings opportunity that exists. So last year, Aon worked across a group of our customers, brand new customers, and they compared claims level data to healthcare spend across a set of these customers. So think about the size of the customers. They were 1,000 employees all the way up to 30,000 employees against a highly matched control group to determine what the impact was going to be. Here's just a few things that they found in their findings. First, that in 2019, the control group costs went up to 8.3%. But for those Accolade customers that deployed us, though, their costs stayed flat. They had 0% growth trend for healthcare spending. And in that same year, customers saw a per employee per year claims fall dramatically. Why? Because prior to implementing Accolade in 2019, these customers were spending roughly about $590 more per employee per year than the match control group. But after working with us for over a year, they were instead seeing spending $432 less per employee per year in that same control group. This is a tremendous impact. It's because we take the time to build that relationship, help guide the members to the proper services, and be able to leverage the services as they're designed. So as we shared with you guys at the very beginning of today's webinar, we talked about a comprehensive set of solutions, right? The ability to reach everyone, identify personalized needs, and guide clinical decisions. At Accolade, we're offering a really flexible set of solutions designed to meet the employers where they are in their advocacy journey. So let's think about that. Whether you're focused on just increasing your benefit utilization, you put great programs in place and you want to maximize that opportunity, there's a solution. Whether you're focused on high cost support or full population health, there's a solution. As Lanera said, it doesn't have to be a one size fits all approach with Accolade. Every single one of the solutions that we have includes advocacy and navigation. This foundation is what enables us to deliver comprehensive, integrated care and support for every single member that we work with. But it's also that foundation that allows us that opportunity to build. And as we talked about very early on, at Accolade, we're always looking for ways to find out how we can deliver better healthcare solutions for our customers and their members. And in the last year, we've had two phenomenal companies come together with Accolade and join us in this journey to help individuals live their healthiest lives. 2nd.MD and PlushCare. Not only are these great organizations full of great individuals that are focused on this passionate mission that we have, but it also offers us a full new suite of solutions. So PlushCare is a virtual primary care provider that makes it easy for every member to get the care they need when they need it. Leveraging their team of virtual primary care doctors, we can provide members with same-day primary care appointments. We can get them to the ability to address mental health options as well as labs and pharmacies. In addition, 2nd.MD, our leader in expert medical opinion that includes over 900 leading physicians across the US, representing all of the medical specialties. These experts provide members with the certainty that they need to pursue the right care path. The foundation of what we want you all to walk away with is this. First, understanding that healthcare advocacy is important. Why is it important? How does it help members address the complexity of navigating the healthcare system? Secondly, what you need to look for when it comes to a healthcare advocacy solution. You got to look for a comprehensive approach. You have to be able to address all individuals across the full population. And by engaging everybody in a personalized way, it's going to drive those healthcare outcomes. And finally, those advocacy solutions that you choose to look at have the flexibility to meet the changing needs of your business. Remember, not a one size fits all, but connect your members to the right type of care the first time. If you'd like to learn more about Accolade and our solution sets, feel free to visit us at accolade.com or send us inquiries at accolade.com. I'm going to turn it back over to Mark.
On behalf of UCSF, on behalf of UCSF Health Hub and the upcoming UCSF Health Awards, thank you for attending this. This is great. The Accolade solution obviously is super important, super powerful, and it shouldn't be a surprise why, out of 1,000 submissions, they're one of our winners. Have a great rest of summer, and best to you all, and thanks for attending. Really appreciate it.